Hello and welcome to Let's Talk About, a health podcast series brought to you by Tallaght University Hospital in partnership with the Adelaide Health Foundation. This is our second six-part podcast series, which you can find on the hospital YouTube channel, Facebook page, Apple Podcasts and Podbean. Each episode in the series will be targeted at anyone who wants to learn more about their brain, how they can mind it and how they can keep it healthy. Weighing in at approximately 3 pounds or 1.3 kilograms, the brain is a complex organ that is made up of soft tissue called grey matter and white matter, which contain neurons. Neurons are cells that send and receive information throughout our bodies in the form of electrical and chemical signals. Think of your brain as mission control for how you move, your senses, thought and reasoning, memory and vital functions such as your heart rate and breathing. Like everything else, your brain ages, but as you will learn in this series, there are lots of steps we can all take to help maintain a strong and healthy brain. The most important thing to remember is, it is never too early or too late to look after your brain health. Hello, my name is Paul McElwain. I'm a consultant geriatrician at TUH and your podcast host. Today, in this Let's Talk About podcast, we're going to talk about brain health and the importance of a healthy heart. I'm delighted to be joined by Dr. Aoife Fallon, consultant geriatrician, and Pauline Boyle, senior dietitian. Hello.
Hello, Paul.
So, Aoife, can you tell our listeners why a healthy heart helps the brain?
Well, we know that a healthy heart and a healthy brain are very closely linked. When we talk about heart health, we're really talking about cardiovascular health, the health of both the heart and the blood vessels that ensures that organs throughout the body, including the brain, get good blood supply and continue to work well. We know, and we have known for a long time, that cardiovascular disease is a risk factor in developing vascular dementia and vascular cognitive impairment. But more recently, we also have learned that it's a risk factor in developing Alzheimer's disease. So by managing your cardiovascular risk factors, you can reduce your risk of developing both vascular and Alzheimer's dementia in the future. The cardiovascular risk factors we'd often talk about are things like diet, smoking, alcohol, and medical conditions like high blood pressure, high cholesterol and diabetes.
Okay, so Pauline, you might, in your role as a dietitian, highlight some of those risk factors and how we would go about managing them.
Yes, Paul, indeed. Well, a healthy balanced diet, or often you hear people talking about the Mediterranean diet, is the recommended dietary approach in relation to brain health. So how do we follow a healthy balanced diet and what does this mean? Well, this means eating less salt, eating more fruit and vegetables, choosing whole grain foods, cutting down on fatty foods or processed foods, and lastly, eating more fish, especially the oily fish.
Okay, so could you tell me a little bit more about this?
Indeed, we know that too much salt in your diet can increase your blood pressure and can impact your brain health, as Aoife has explained in the introduction. The recommended upper limit of salt intake is 6 grams per day, and this equates to just less than half a teaspoon. So how can we achieve this? How can we reduce the salt intake to less than half a teaspoon per day? My first tip is to firstly put away the salt cellar. So avoid adding salt to your food at the table and maybe use other flavourings like pepper, garlic, lemon juice, herbs and spices, and so on to flavour your food instead of adding that salt to your food. And the next tip would be to live by my motto, fresh is best. And the reason for this is because there's so much hidden salt in processed or packaged foods. Let me give you an example. A sachet of cuppa soup may contain 2 grams or even more of salt, and that's almost half of your upper daily limit intake and should be avoided. And this together with other salty foods perhaps are, ready prepared meals, salted snacks like crisps and nuts, sausages, cured meats, burgers and so on, these should also be avoided or limited and replaced with the fresh options. Moving on then from salt, I'd like to talk to you about fruit and vegetables. A good intake of fruit and vegetables is so important for lots of different health benefits, but particularly associated with better brain health. It's recommended that we should eat 5 or more portions of fruit and vegetables per day. And most likely everyone listening here today would have heard of the 5-a-day campaign.
Well, yeah, I've heard of the 5-a-day campaign. So can you tell me a little bit more about that?
Yes, Paul. Well, there's lots of easy ways to increase your fruit and vegetable intake in the diet. And firstly, just to mention that all fresh, frozen and even canned varieties can count in this 5-a-day tally. So let's start off at breakfast time. I'd suggest adding dried or fresh fruit, maybe some berries or chopped bananas to your porridge or your cereals. You could try adding grilled tomato, mushroom or beans onto the side of a savoury breakfast. So we should have a piece of fresh fruit or a handful of dry fruit for in between meals, or perhaps when you're on the go. This is a good way of getting in extra fruit. And at lunchtime, it's a good idea to try bulk up your sandwiches by adding salad vegetables to your sandwiches to make a nice thick sandwich, or maybe choose a homemade vegetable soup. When it comes to dinner time, my general rule of thumb is to draw an imaginary line down the middle of the plate, and half the plate should then be filled with vegetables. And when we're looking at that plate of vegetables, those vegetables should have lots of different colours, because this will also give us lots of different vitamins and minerals. And one final note on fruit and vegetables is we need to remember that the potatoes and our sweet potatoes and other root vegetables are not actually classified as a fruit and a vegetable, so they don't count in that 5-a-day tally. So in addition to reducing our salt intake and increasing up our fruit and vegetable intake, we must also include fibre or roughage to improve the heart health and to improve brain health. So we should be trying to eat more whole grain foods, so more whole grain breads or wholemeal breads and pastas or cereals. For example, we could try porridge in the mornings or Weetabix or shredded wheat. These would be good choices for your breakfast cereals. Or maybe you could try leaving the skin on the potatoes at dinner time, and this would increase up your fibre intake in your diet as well.
Okay, and you mentioned that reducing overall fat intake could have a benefit to our brain health. How would you go about doing that?
Well, there's a number of ways to do this also. And I suppose if we start with the first way, we should choose low-fat dairy products rather than full-fat dairy products. And the second thing would be to review our cooking methods. So we should all put away those frying pans and those deep fat fryers, as this will reduce the fat content significantly. Other cooking methods could be used, so you could try grilling, baking, boiling, steaming, roasting, or even stewing your food to take the fat content away from the diet. And lastly, cutting down or avoiding those takeaways or heavily processed foods. This will again reduce the overall fat content in the diet. I'm just going to move on to the last component of the Mediterranean diet, if I may, which is the oily fish. And oily fish is a very rich source of omega-3 fatty acids. And we know from research that a higher intake of the omega-3 fatty acids has been linked to a lower decline in memory. So some examples of these oily fish would be our salmon, mackerel, herring, trout, sardines, and fresh tuna. So it's recommended that we have 2 portions of oily fish per week. So again, you could try delicious sardines on toast for your lunch, or a salmon fillet maybe on your dinner plate tonight to meet those recommendations.
Okay. And how about alcohol, Pauline?
Excessive alcohol intake, we know, Paul, is common and can lead to many health problems. The general advice is to cut down and indeed always have alcohol-free days. But more specifically, the advice for the general population is to have less than 17 units per week for a man and less than 11 units per week for a lady, whereby 1 unit equates to just a half a pint of beer or a very small glass of wine, just 100 mils, or a pub measure of spirits. And in certain cases, your doctor may also advise less than this 17 units or 11 units for men and ladies respectively.
Okay, so if I might bring you back in here from a doctor's perspective, what can we do to keep our hearts healthy?
A lot of what Pauline has covered will help to keep your heart healthy, but from a doctor's perspective, we'd often look at smoking. So we know that smoking is a major risk factor for both heart disease and I suppose it is a risk factor in your brain health as well. So if you are a smoker, one of the best things you can do for your health is to stop smoking. Then to move on to other cardiovascular conditions like high blood pressure, cholesterol, diabetes. So high blood pressure is often identified by your doctor. In some cases, you might need a 24-hour blood pressure monitor to diagnose it. And if taking measures like reducing your salt intake and looking at your weight don't impact your blood pressure, you might need one or more medications to manage your blood pressure. Cholesterol then, that's identified through a blood test. The first step, as with high blood pressure, is addressing your diet and trying to reduce the intake of fats, as Pauline had suggested. But some people need medications in order to control their blood pressure, and you'd be discussing targets with your own doctor as well. Then diabetes, so all of the advice given by Pauline about diet will be really important in diabetes, and reducing your sugar intake as well. For people with type 1 diabetes, they'd be prescribed insulin, and for people with type 2 diabetes, generally take oral medications as a first line, but may also require insulin in the future. And we know that keeping your blood glucose within a healthy range will reduce your risk of developing cognitive impairment and dementia. And then finally, I suppose when it comes to the heart, people may have ischemic heart disease. So that could be that you have had a heart attack, that you're at risk of having a heart attack, or conditions like heart failure. There are medications prescribed to manage these. And while they manage your heart health, having a healthy heart, as I said, is really important in having a healthy brain. So they'll have that effect as well if you're on the correct medications for those kind of conditions.
And finally, Pauline, what advice would you give on the use of supplements for our heart and brain health?
Well, at this point in time, they're not recommended because there isn't any evidence at present in the research to show that these medical food products would be beneficial in the prevention of brain health decline. So we can't recommend those at the moment. Okay,
so usually we ask our contributors for a top tip or a take-home message. So Aoife, I might ask you what that take-home message might be.
So our take-home message would be that heart health and brain health are really closely linked. So managing cardiovascular risk factors through making healthy lifestyle choices and managing conditions like high blood pressure, high cholesterol that can affect your heart, allow you to maintain both a healthy heart and a healthy brain into the future.
Thank you so much to our contributors, Aoife and Pauline. I think your take-home message was very clear. And that's a wrap for our second 6-part Let's Talk About podcast series, generously supported by the Adelaide Health Foundation. I hope you've enjoyed the series and have learned something new. Thank you to all the contributors over the course of the series. You can listen back to the series, or indeed the previous podcast series, on the TUH YouTube page, Apple Podcasts or Podbean. Thank you, and let's talk again soon.